Good evening. Today I'll continue to be talking about the coronavirus and the newest updates and news about it. So first, let's just talk about President Trump's address from the Oval Office today on the coronavirus. So him addressing from the Oval Office is actually very new because he has only done this once before, and by doing this, it is a symbol of how important and dangerous this outbreak is. So his actions that he will begin to start to prepare for the coronavirus is that 1, he will be suspending all travel from Europe for 30 days beginning on Friday, but these restrictions do not apply to Britain. 2, he has said that health insurance companies had agreed to extend insurance coverage to cover coronavirus treatments as well as waive related co-payments. 3, he will announce an emergency action to provide financial relief for workers who fall ill or need to be quarantined. He would ask Congress to take legislative action to extend relief. And 4, he would instruct the Treasury Department to defer tax payments without interest or penalties for certain individuals and businesses negatively impacted. Basically, a summary of what he's saying is that he's trying to stop new cases in the U.S. from Europe, and 2, he will provide financial support for those who are still going to work because they are afraid that they will be fired, they'll lose their jobs, and they won't have money to support their family, which is really common right now, even though they have a really large chance of getting infected. So by providing them financial relief from treatments if they get ill or preventive measures, this is actually helping the American people stay home and avoid infection, because if they continue to work in fear that they will lose their job, then they could simply just be spreading the infection and eventually get ill. So the second thing I would like to talk about today is that the World Health Organization declared the coronavirus as a pandemic. Basically, a pandemic is the highest level a infectious disease could reach. It is basically a worldwide spread of an epidemic or outbreak. So what this means is that the World Health Organization before has delayed from using this term of pandemic in fear that countries will give up their protective measures, thinking that, oh my goodness, this coronavirus, we can't prevent it, so they're just gonna give up, and that's what the World Health Organization was afraid of. So they have just delayed the term, but now it's getting so bad that they have to use this term. But honestly, in my personal opinion, I don't think that them labeling this as a pandemic is going to help anything, because scientists and infectious disease experts have already called this a pandemic days ago. So everybody already knows, including me and everybody else I know, they already know that it's a pandemic going around several continents and killing thousands and thousands of people. They already know it's a pandemic, and countries have already begun to take protective measures. So I don't think that them labeling this as a pandemic is going to help anything, but it is just like a symbolic action that could be taken by countries in order to try to prevent this disease, but it's not really anything that will help because countries already know how bad it is. So the next thing I would like to talk about is Dr. Anthony S. Fauci today has mentioned that he said the bottom line is that it's only going to get worse in America. So what this means is that, first, I'll just talk about Dr. Anthony S. Fauci. He's the director of the National Institute of Allergy and Infectious Diseases, and he has become the spokesperson of this virus because other leading scientists doesn't like to talk to the news and public about it, but he has become the leading spokesperson, and he said it is going to get worse. Basically, this is already just foreseeing a huge outbreak in the United States of cases that is going to appear, and many deaths that will occur because of this virus, and we should all take preventive measures to try to at least try to avoid getting the disease, such as recently Washington, Kentucky, New York, and other states have already moved towards stronger measures, including bans on large events, playing the NBA games in an empty arena, and you can't sit shoulder to shoulder in local bars. I think these protective measures should actually be encouraged, because by doing this, these states are trying to protect us, the American people, and we ourselves should be self-conscious of what we're touching, how are we going to like come in what should we do if we had come in contact with an infectious person. And I think we should encourage this kind of behavior and mainly just try to protect ourselves. So thank you for listening and have a good night.